Waongezee staff.
Elsewhere, the government has intensified efforts to scale up human papillomavirus vaccine among young girls, describing it as the most effective long-term interventions against cervical cancer. While urging parents to fully embrace the vaccine, Health Principal Secretary Mary Muthoni says the ministry is targeting more than 90% uptake of the HPV vaccine among girls below the age of 14, with the bulk of the exercise being carried out through structured school-based visits to ensure wide coverage. The BS stresses that the vaccine is safe, globally approved, and has been administered in the county for several years. Additionally, she notes that vaccinating girls before exposure to the virus significantly reduces the risk of cervical cancer later in life, saying that early prevention is far more effective and affordable than treating advanced diseases. The government also aims to screen at least 75% of women countrywide to improve early detection, adding that cervical cancer remains one of the leading causes of cancer-related deaths among Kenyan women because many seek care only when the disease is already at an advanced stage.
To have 90% HPV vaccination for our girls, that the girls who are in school 14 years and below, let them get vaccination, HPV vaccination to prevent the same. Let us have more than 70% of our women going for screening. And that has been my campaign the whole of the month. And let us have quality healthcare in our facilities, and that is between me and Waziri to make sure that we have the equipment, we have the facilities, and we have the human resource to treat cancer, so that 90% of the women who are found having cancer are treated.
A section of leaders from the matatu transport sector